Good morning, all. So the topic for today is impression materials. I'll be discussing it under the following contents. Introduction, definition and classification, ideal requirements, history, impression materials and techniques. What all impression material which we are using in dentistry, that and all we'll be covering in this chapter. So an impression, it is a negative reproduction of teeth and surrounding structures. An impression material is any material which we are used to make the impression. What's the purpose of making impression? So you guys, when you reach in third year, patients will be coming to you with a chief complaint. So initially we have to identify the problem. What is the chief complaint of the patients? So accordingly, we have to diagnose the case. What is the, according to his chief complaint, we have to diagnose the case and decide what is the treatment plan. Once we decide the treatment plan, we have to make the impression. That is the next step. So to make the impression is to get the negative likeness of the dental structures and constructing the cast. So there are some ideal requirements for the impression materials which we are using. So first one is it should be fluid enough to adapt the oral tissue. That means it should not be too viscous or too liquidy. It should be having certain kind of viscosity to adapt the oral tissues. And it should be viscous enough to contain in a tray that is seated in patient's mouth. That also there should be a certain kind of viscosity for the impression material which we are using in the patient's mouth. If it is too viscous, it will be causing pressure, applying more pressure on the patient's oral mucosa. If it is too liquidy, we won't be able to carry it into the tray, impression tray. So the next is in the patient's mouth. It should set in a certain amount of time. It should not set too fast or it should not set too delay also. If the patient comes to us, if the patient we have made the impression, if the setting time of material is like 15 to 20 minutes, that will be difficult for us also, to the patient also. If it is setting too fast also, that will be difficult for us to make the impression. There won't be enough time for us to mold the impression. So there should be a certain amount of setting time for the impression material which we are using. And the set impression should not distort or tear while removing from the patient mouth. The impression, we have made the impression while taking it out, if it is distorting or if it is tearing, it's of no use. The making of impression is of no use. So it should be rigid enough while taking it out from the patient's mouth. Next is it should be dimensionally stable at least until the cast is poured. That impression material, it should be dimensionally stable. Next, it should be biocompatible. Any material if you are keeping in patient mouth, it should be biocompatible. It should not cause any trauma or any allergic reaction to the patient mouth. That's why any impression material which we are using should not cause any allergic reaction. That is, it should be biocompatible. Next is the impression material should not be too costly. There are some setting mechanism. According to setting mechanism, the impression materials are divided into reversible and irreversible materials. Reversible materials, they are basically undergo physical changes. Physical changes means we can reuse the impression material. Example for those type of impression materials are agar and impression compound. Impression compound, you guys are familiar as we can change reuse the impression material if the impression in the first step is not come out properly. It is under thermal changes, we can reuse the impression material. That is, it undergoes physical change. There's no chemical reaction happening in the impression compound. Next one is irreversible impression compound. Once you have made the impression, if the impression has not come out correct, we have to reuse the we are not able to reuse the impression material again. We have to use a next batch of impression material. That is the difference between reversible and irreversible impression material. Next is mechanical properties of impression material. That depends on rigid. There are two types. Again, it is rigid impression material and elastic impression material. Elastic impression material, the quality it can be stretched. That is the basically we can use it under patients with the undercuts. In patient mouth, if there is a deep undercuts, those areas we can use the elastic impression materials. The example is agar and alginate. Rigid, next one is rigid impression material, which is difficult to remove from the undercuts. So basically, they are used in edentulous patients. Edentulous patient, we won't be able to use. Even if we use, we won't be able to retrieve it from the undercut area. So example for rigid impression material is zinc oxide eugenol, impression compound, and impression plaster. Coming to classification, there are so many classifications. In exam, if they are asking the classification, you guys have to write at least 2 to 3 classification. So according to use, it is classified into stock tray impression and special tray impression. Stock tray impression is ready-made trays are available for edentulous patient and dentulous patient. Edentulous patient, it is non-perforated trays. And for dentulous patient, there are perforated trays available. And the next one is special tray impression. Special tray impression is once you have made the primary impression, we'll pour the cast. From that primary cast, we'll be customizing the special tray. The special tray will be customized for a particular patient. That is special tray impression. Next is according to setting reaction. There are 2 types. We have discussed it earlier. That is reversible and irreversible. Reversible materials, it is softened by heat and hardened by cooling. Example is impression compound and agar. We can reuse the impression material again and again. If the impression has not come out correct in the first step, we can take it out, remold the impression, soften it, reuse the impression material. That is advantage of reversible impression material. Next is irreversible impression material. That means they set by chemical reaction. If the impression has not come out correct in the first attempt, we won't be able to reuse the material. We have to discard it, use another batch of material. Example is impression plaster, zinc oxide eugenol, agar, and elastomic impression material. Elastomer. Next classification is by the manner in which they harden or set. One classification, if you learn, you can, from that classification, you can write 2, 3 classification. That is by reversible material, it is same like temperature changes. It undergoes temperature changes. Irreversible material, impression materials, they undergo chemical change. So example for irreversible impression material is plaster of Paris, zinc oxide eugenol, alginate, and elastomers. So reversible impression material, impression compound comes and agar. They both are thermally, we can manipulate the impression material. According to the ability to set to be withdrawn from the undercut. That is elastic impression material and non-elastic or rigid impression material. Rigid impression material we have discussed before. That is impression compound. Once you have taken, basically we won't use it in areas with the undercuts. In rigid impression material, we cannot be used in areas with patients with undercut. In dentulous patients also, we are not supposed to use rigid impression materials. Elastic impression material, the basic advantage is we can use in areas with undercut. Example is hydrocolloids, that is agar and alginate, and rubber-based impression materials. Those under these comes the polysulfide, polysilicon, polyether, etc. Next classification is according to use of the material in dentistry. That is again the material used in obtaining impression for dentulous mouth and edentulous mouth. Dentulous mouth we can use alginate, agar, and non-aqueous elastomers. Materials used to obtain impression of edentulous mouth is example is impression compound, impression plaster, zinc oxide eugenol, and wax. According to viscosity or the tissue displacement, there are 2 types. Again, those are mucostatic and mucocompressive. Mucostatic means once we are making the impression, it won't cause any displacement in the oral tissue. It will be the tissues will be stable. So those are mucostatic. That is example is alginate impression material and agar. Mucocompressive is impression compound and putty elastomers. They have higher viscosity. Their flow is not much. So as the viscosity increases, they will tend to displace the tissue. That is mucocompressive impression materials. So in as we draw a chart, basic conclusion, we can classify like how we are seeing in this chart. Impression compound, basically it is classified into hydrocolloids and elastomers. Under hydrocolloids, there comes the reversible and irreversible impression material, and synthetic elastomers are polyether, polysulfide, silicones. Under silicones, there are two types: addition silicon and condensate silicon. These all the about all these impression material will be discussing in further coming slides.